All right. Next up is diagnosis. Over to you, Simon.
Okay, so we need to understand that craniofacial growth and bone muscle interaction are intertwined. And all the decisions that we make for orthodontic problems have to understand the interrelationship. Diagnosis comes before treatment planning. We've got to determine, are we dealing with normal growth, hypodivergent growth, or hyperdivergent growth? Normal growth allows the two jaws to grow in harmony where they match up at the end of growth. Hypo and hyperdivergence is where the two jaws are growing completely in different directions, either converging or diverging excessively. We know that this is intertwined with high tone and low tone children. High tone children present as class 1. Low tone children usually present as division 1 malocclusions, class 2 division 1. Division 2 malocclusions are usually high tone, strong muscles, the bruxes. Low angle class 3s are high tone. High angle class 3s are low tone. Their jaws diverge because they're never together. You can have hyperdivergence in class 1, hyperdivergence in class 2, and hyperdivergence in class 3. All right, the angles classification is talking about AP, the sagittal. Divergence, the mandibular plane relative to Frankfurt, we're talking about the vertical dimension. They're actually two separate dimensions. You can have mixture. You can have high muscle tone, but an open bite. Again, we use our Ceph not only for the hard tissue, but we can use it for the soft tissue. There are clues everywhere in that image. These are all markers that sleep physicians are interested in, ENTs are interested in. Most of you just want to find out more about the widget, right? The appliance, the gadgets. We're dentists, we love gadgets, yeah? We're not that interested in reading the instructions. We just want the gadget, right? Like we have the rep come in and they book an hour and we turn up half an hour in eating half-hour sandwich, right? And you're making sure your hygienist has been listening. And then you apologize. And then she starts talking again about the laser or the gadget, and then you start checking your phone, right? Because you're paying for it, but you don't have to know how to use it because it's up to the staff to do all that work for. So there are lots. Like, why are there so many appliances? Now, why would there be so many appliances? There's only two reasons why there'd be so many appliances. They all work, and it's a competition for the manufacturers to get in your favor, or none of them work. Right? They're the only two reasons why there's lots. They all work or none of them work. So you figure out, based on the fact that the orthodontic profession no longer uses removable appliances, what that is. The single most important thing you have to understand, anything we do orthodontically adds vertical. It is a side effect. And in hyperdivergent patients, it's what we call an adverse effect. In hypodivergent patients, it's a side effect with benefits. We understand tip and we understand torque. and they're different. Moving crowns are easy, moving roots are hard. The majority of the children, 80% of the children who walk through your door are class 1. They have strong tone. You can do whatever you like. It will all work. But the low tone children, whatever you do will add more vertical. And you'll find most of the low tone children are hyperdivergent, not hypodivergent. Hyperdivergence break everything, yeah? Who has patients where they ping off this or break that? They're always the hypodivergent. So they work against you because their tone is too high. So anything outside of the normal range is going to make your life difficult. Most specialists don't recognize when someone is hyperdivergent. That's how hard it is sometimes to see the tree from the forest. We need to look at more than just X-ray imagery. We have to read the face. We have to watch them interact with us in speech, in swallow. All those aspects give us clues as to a child's posture. And when we understand their resting posture, how they leave their mouth at rest, we can then start to piece together that confusion, which is it normal divergence? Is it hyperdivergence? Is it hyperdivergence? The habits of how they use their mouth give you vital clues. There is more than just bone for us to evaluate. We have to evaluate the soft tissue as well. You cannot be successful if you don't know what you're dealing with. It literally isn't a one key fits all locks. It's confusing. I mean, that's why there's a 3-year residency to get your orthodontic license. It is confusing. There's a lot to it. Anyone who thinks this 2-day program is enough to get them started is mistaken. All right, this is a wonderful interest piece for many of you. This is CPD points for many of you. Some of you will want to just use my gadgets, my widgets, the appliances. Some of you will just want to use the exercises. But we know historically through the previous teaching, 23% of you are interested in me holding your hand and guiding you through all the potholes so that you come out at the end of 12 or 18 months with a successful outcome. So a lot of what I'm going to do this weekend is focus my energy to help you guys achieve whatever goal you want. Whether it be just a couple of things that you want from my program or my entire program. Multi-factorial. That's science speak for we have no idea. It could be everything. It could be nothing. It's a big mystery. That's what multifactorial means. But I want you to think about, in a sea of confusion, just drawing a line in the sand and taking a stand and saying, okay, this is what I'm going to believe in. The size, the volume that you are going to grow into is genetically determined. But the shape and the balance is an environmental factor. This is the single most important slide that I can give you in order to allow you to practice safe orthodontics. Treat dental problems dentally and treat skeletal problems skeletally. All right. You don't want to have a 6-year treatment where you are trying to correct a skeletal problem using orthodontic dental solutions. Yeah. Skeletal problems, treat skeletal. Treatment planning. Who can start the most difficult case in the universe? Who can finish the most difficult case in the universe? All right, anyone can start anything. Who can start a full mouth rehab? Who can finish it? All right. Would you start anything in dentistry that you can't finish? And the answer is, of course not. But how come when a little kid walks through the door and you've done a weekend course, you think you can start this case because you were told you owe it to the universe to help this child, this particular child that walked through the door, even though I don't know that child. So there's a lot of lecturers out there who want you to take on everything and do everything. And I'm going to tell you, if you join my advanced mentorship program, I'll probably tell you not to treat most of the cases that you present to me, because I want you to be able to finish. Who can do a 3rd molar root canal, which is sclerosed pulp and has 4 canals that end in the spiral? All right, that's early intervention orthodontics. It looks easy, but it's not. Unless you pick easy cases. You start your practice. Sign the bank loan for your $1 million mortgage. Set up all the equipment. Feeling good. And it's crickets waiting for the new patient, right? New patient walks through the door. He says, "Hi, I've heard good things about you. I want a full mouth rehab. Here's $100,000 in cash. When can we start?" Second patient walks through the door. "Hi, I've heard good things about you. I want a full mouth rehab. Here's $100,000 in cash." Third patient walks through the door. "Hi, I've heard good things about you. I want a full mouth rehab. Here's $100,000 in cash." Puts the cash on the table. And you're thinking, "I'm a new graduate. I haven't even cut a crown yet." Are you going to try? There's 300 grand sitting on the table and you've got $1 million mortgage. Right? This is what early intervention ortho is. You will never have a parent say no when they come in saying, "I want help. I think there's something wrong with my kid." Whatever you say, they'll say yes. But the question is, can you finish? You need to know what your goals are. Like, what is the plan? 32 adult teeth, 28 adult teeth, 24 adult teeth. Like, what's the plan? You need a vision in your mind as to what is ideal. Do you know what's ideal? If you don't know what's ideal, how can you recognize when things are not ideal? I mean, is it a 32-tooth occlusion? Have you seen them? Can you fit a coin between each primary tooth? Like, do you know what an ideal occlusion looks like? Because my image of that ideal when I was a restorative dentist is perfect veneers on the top and like crowded teeth down the bottom. That was my image of success. I got 10 veneers on the top. Looked just like that. The bottom was like that, but right? You got to have an image in your mind as to what's your endpoint. And if your endpoint is this, when do you start? Like if you have a goal of 32 adult teeth fitting in nicely, like at what point do you start? How long does it take for that to happen? I created those occlusions. They were all created by me. But I've got a vision in my mind as to what it should be. So then I could create that. I've got a vision as to what we should be. How do we fit everything in? How do we go from where we are to where we want to be if we don't know where we want to be? Like, do you just hop in the car and drive? And if you're lucky, you get to where you want to go? Or do you have a destination and a map to get you from where you are to where you want to be? You've got to know what ideal is. Like we recognize an individual tooth when it's perfect and when there's decay, right? Like it's perfect or it's not, yes? There's no in between, is there? Like it's a perfect tooth or there's a hole in it. Little hole, medium hole, big hole, it's still not right. You've got to recognize this orthodontically as well. Let me tell you a secret. If you're not perfect at every point in your life, you're not going to end up perfect. Because it's a long journey. If I'm heading towards Brisbane and I start driving and I cross the South Australian border, am I going to make Brisbane anytime soon? I have to be facing the right direction at all times in order to be able to achieve my destination within the timeline that I want. I can't take a pit stop in Adelaide on my way to Brisbane unless I decide Perth is as good a place as any. Because there's a point where it's finished. Okay, recognize what's not ideal and what is. You've got to be able to see it. Now, here's the thing. We all see it. Right? When you look at someone, in a split second, you can rank them from 1 to 10. Tell me who can't. Instantly, you can recognize and categorize a person's face. Instantly. It is inborn. Babies can recognize the difference. Why? Because it's so vital to our health and well-being to be able to recognize ideal specimens of human beings. Because that's the reproduction game. If you can't tell this 7-year-old on the left is not tracking well, then how will you get them at 13 to there? I made this happen because I know instantly what looks right and what doesn't. Because I know what works and what doesn't, what fits and what doesn't. Every part of you in its own place with its own space. There's only certain dimensions that work. There's only certain positions that work. Every other position doesn't work. And you need to know the difference between good and great. How do I know you already know? Your dentist. 97th percentile, right? When I was a kid, I grew up in a family where I would come home to dad and say, Dad, I got 97. And he said, what went wrong with the 3? I got mates who got 51 and ice cream. All right, where do you want to operate? Is good enough good enough? Or are you living the life of the 97th percentile that you are? You have to work this out yourself. You're going to make your own keys and decide which doors you want to open. Because you don't have to open every single door. You need to be able to recognize where the soft tissue lives. This is just by chance, the radiologist took 2 x-rays. Don't know why. But one, her tongue was perfectly positioned, and one, her tongue was off. This x-ray, this pair of x-rays taught me everything about how to work out where the tongue and the higher bone is, just by chance. This is what the radiologist asks of every child when they take a lateral set. Lips together, teeth together, tongue on the roof of the mouth, hold still for 10 seconds while I take the x-ray. I want your mouth closed, right? When you get an x-ray back and the teeth are apart, you ring up and say, hey, retake it. I can't work out the angles classification if the mouth is open. You have to have the teeth together, yeah? In maximum intercostation. So that's what the radiologists do. What's this? And the molars touching? Okay, let's try again. Lips together, teeth all together at the back, mouth closed all the way. Stay very still. 10 seconds. I'll be back. Okay, one more time. Back teeth. Okay, back teeth. Bite, back teeth together. Great. Lips together. Hold still. 10 seconds. Be a statue. Yay. Why is it so hard? It's bite on your back teeth. Your normal bite. Have you ever thought about why kids can't close their mouth? Read the soft tissue. How big are the adenoids? When the tongue is fully on the roof of the mouth because the mouth is fully closed, the soft palate is jammed up against the adenoids. How long can you hold that? So if you're retruded and you've got a big tongue, you're going to hang your mouth open because you can't breathe. We don't work in a vacuum. Yeah. Habitual rest for most children is lips together, incisors in class 1, molars wedged apart with their tongue. That's called protecting your airway. Because when you're in maximum interpulsation, you can't breathe. And it's not just for the kids with blocked noses. Most kids, when they're fully closed, can't breathe properly. The skeletal malocclusion children can't breathe, even if their nose does work. All right, that's the end of diagnosis. And we can start Q&A.
Okay, let me hit the stop recording.